Hi, I'm Ashley Gazich, a volunteer with C19 Coalition. I have been a volunteer since about April, running programs for reopening, supporting community-based organizations, food supply chains, and schools. And I'm here today with Dr. Shikha Gupta from Gazich PPE. Dr. Gupta.
So great to be here. Thank you so much for having me. So as Ashley mentioned, I'm a physician by training, and I'm currently the executive director of Gazich PPE. And like Ashley, I started off as a volunteer with the organization back in March when we first got started. And our goal since then has been to deliver as much PPE as we can to the people who need it most. And I'm proud to say that with much help from many of our partners, including the C19 Coalition, we've been able to deliver over 6 million units of PPE around the United States. And there's lots of work to be done.
That is an incredible number. And one of the reasons that I've really enjoyed getting to work with Gazich PPE over the last few months more closely is taking a look at where the need is, what we can do about it. And very specifically, one of the efforts that we're undertaking now is a joint fundraiser. As mentioned, Gazich PPE is one of the early coalition members. And so we thought between the scale of C19 Coalition, the insights that Gazich PPE has, we could team up and really focus our efforts on getting those resources to those who need them most. I've been following the Gazich PPE Shortage Index, which is a monthly report based on the information that comes in from PPE requests, what the need looks like, where it is, and some really jarring numbers that I saw that I just kind of wanted to highlight is that over half of the requesters need N95s, and 2/3 of the requesters reported being completely out of at least one type of PPE. And even more, as you mentioned, the need's not slowing down. So I wanted to talk a little bit about, who are we helping? Why does this matter? And what can people do specifically to support this mission?
Such good questions all around. And one of the most striking things is that we, as Ashley mentioned, publish that index monthly, and things change so quickly. So an even more shocking statistic is that between November and December, at the time of publication, it was a 34% increase, and now it's a 260% increase from November to December in the number of requests that we've received for PPE. And when you think about who we're trying to help here, our goal is really to help the people who don't have any other resources or recourse to get the supplies and the equipment that they need. When Gazich PPE was founded, a lot of our material and our resources were going towards helping academic hospitals, the big hospitals that you see on the news. But over time, what happened was, as those hospitals started to be able to purchase their own equipment, we unearthed this longstanding equity issue in American healthcare. So the people who aren't able to get PPE now are places like nursing homes or small clinics, rural hospitals. They're the ones that don't have the deep pockets. And even if they did, with the inflated prices of PPE and the difficulty in ascertaining what's real and what isn't, it's a really high bar to ask somebody to figure out how to navigate that system, to find the funds, and to wait for as long as it might take to get that equipment. So Gazich PPE has really been focused on underserved and under-resourced communities that have been disproportionately impacted in so many ways, but especially by COVID-19.
We have seen a lot of that in our joint conversations over the last several weeks, whether that's PPE for schools. Teachers are doing fundraisers and they're doing PPE wish lists. We have seen a number of calls come into the C19 Coalition hotline for care facilities talking about the need out there and the very real impact that not having what you need to protect yourself when you go to work has. When a teacher is making a wish list for PPE, or someone who works at an assisted living facility has to go into work and doesn't have the masks that they need, what kind of stories are you hearing around those concerns?
It's really heartbreaking. these are the people that we've been asking for almost a year to show up to work every single day to do essential jobs and tasks to serve you and me, their communities. And to expect people to show up to work every single day fearing for their lives, which is ultimately what happens when they can't be sure that they're adequately protected from the coronavirus. It takes a toll. And I think there was a lot of celebration and support for essential workers early on. And certainly that has persisted. But in my opinion, as I watch my colleagues go to work every day and often not have the protective equipment they need, to me, the best show of support that we could possibly offer these people is to give them the protection that they need and deserve. The right to be healthy is fundamental. And by not protecting people that are showing up in workplaces and being exposed to a virus, that is taking away that right. And it is a privilege to be able to stay home and to socially distance and to work from home. Many people, especially those that we serve, aren't able to make that choice. And they do have to show up physically every single day. And they show up physically to support the infrastructure of their own communities. So it is up to us. It's part of our responsibility to make sure that we're doing everything we can to keep those people safe, protected, and healthy.
Kind of breaking things down, what can an individual do, whether that's helping in their local community, helping contribute to Get Us PPE's mission? How would you break that down if someone said, hey, I've got a little bit of resources, I'd like to help on the personal level?
It's such a good question. And I think it's one of the reasons that I look at Get Us PPE and the C19 Coalition as kindred spirits, because I think both of us really believe in the power of collaboration and the strength of individuals coming together for a common cause. And it doesn't have to be complicated. People don't have to have super deep pockets or be able to quit their jobs and do this full time. It's a matter of taking small steps. And the first and most important one is, of course, to practice the same hygiene and safety habits that we've been talking about since day one of the pandemic. Staying home, staying socially distanced, and wearing masks is really a crucial element. And that's something that every single American can do to keep their fellow citizens safe. If people want to go a step further, there are so many opportunities. At Get Us PPE, we're a totally volunteer-driven organization. So we really rely on the generosity and the giving spirit of the people that work with us to move our organization forward, whether that means calling facilities to find out who needs PPE, or helping with logistics or programming to help us set up our technology infrastructure, or working on development and communications. Any skill set is valuable to us. We really are just looking for opportunities to work with people who want to make a difference. And then, of course, there is the opportunity to make a financial contribution. And this is, again, a place where, to me, it's not so much the amount of the financial contribution, it's the willingness to be a part of the solution. And small contributions, large contributions, they all make huge impacts in their own way. And part of that is leading in your community and saying, this is an organization that I support, spreading the word about what Get Us PPE and C19 Coalition are working towards. And even that kind of awareness and sharing our missions can make an enormous impact.
Yes, and that is one of the themes that I have taken strength from time and time again, is the partnership is really what moves things along. And individually, sometimes it can feel like maybe we're not, sure what to do and how to orient ourselves, but taking that step to reach out, to, throw in $5 or $10 if it's possible. When we collectively take action, that's where we really start seeing the impact happen. And so I was wondering if you would be able to talk a little bit about, if you've had any recent donation facilitations or anything like that, where it's gone to those people who truly, truly need this help, and how we're supporting our communities through that.
Yeah, so one of the best parts of this job is the opportunity to talk to so many people who are on the ground and experiencing the PPE crisis firsthand. I think there is this general tendency right now, and especially in the media, to focus on so many other things that are competing for our attention. But the reality is, last week was the worst week that the United States has ever had during the pandemic. We're up to the point where 4,000 Americans are dying every day, which is, if you take a step back and think about it, that is a shocking, unbelievable number. And the opportunity to make even the smallest bit of difference and to help prevent that number from increasing in whatever way we can is what keeps me showing up to work every day. And one of the stories for me that has been most moving lately has been what's going on in LA on the ground. LA is just getting hammered by COVID right now, and it is an all hands on deck situation. We've had the chance to work with the Red Cross, the LA County Medical Association, and so many other partners. And we're actually working to distribute 5 million pieces of PPE in LA alone over the next couple of weeks. And it has been immensely gratifying to watch the efforts of lay people who have no experience doing last mile delivery, people who are learning about what PPE is for the first time, really pitch in and say, how can I help my neighbor? How can I help this hospital or this community or this homeless shelter? And it has been moving and infuriating to see that this is a problem that has persisted for almost a year. And the fact that we're still in a lot of ways in the same position that we were in a year ago, it's difficult to comprehend that. But the fact is that the needs are very real. And so anybody who's able to contribute to making a change or a difference in communities that are hardest hit, like Los Angeles, now is the time to step up to the plate. And we've been so impressed and gratified to watch so many people that we never knew step up to the plate.
That is amazing. 5 million masks is a phenomenal number. And at the same time, I take some reassurance from the fact that there are very simple things that we can do on an individual level by keeping our social distance, by washing our hands, by wearing a mask, when we're out in those public situations and avoiding gatherings. And, kind of thinking about the folks who are the community-based organizations who are really building those networks of trust, who have built their networks of trust. For instance, the Chicano Federation in San Diego, they have handed out over 15,000 PPE kits to the county, which is amazing because if you think about, all of the families that affects who otherwise maybe they wouldn't have had the public health information that they need. Maybe they wouldn't have known where to go get, face masks or face shields and those sorts of supplies. And so thinking about this for, let's say, through the end of January, what kind of goals can we set in rallying that community action? We've got the fundraiser. We're aiming for $100,000. What kind of things would you recommend people do to help us meet that really critical goal?
So I think a huge piece of it is staying informed and sharing with the people around you the reality of the situation on the ground. Big hospitals and the really well-funded places, they are the ones that are in the media. And so I think there is a sense in the general communities of the United States that things are okay with the PPE crisis. But if you look a little bit deeper and look at who the Chicano Federation is serving, for example, or the Red Cross in LA, the fact is they are working around the clock to get people the supplies they need, and there is no end in sight. And so if I was going to ask one thing of people who are watching this video right now and learning about the work that we do, I guess I would ask two things realistically. First, I would ask for them to share this video or to share information about C19 Coalition or Get Us PPE and let people know about the reality of the needs on the ground. Protective equipment is something that's going to be with us for a lot longer than the COVID pandemic. And so it's something that we need to be thinking about. And then the second thing I would ask is for people to make a donation. Anything that you can offer will go a huge way towards making a difference for these communities. And to give you a concrete example, at Get Us PPE, the way we look at it is every dollar that gets donated provides one surgical mask. And every $5 that gets donated provides one N95 respirator. And those are the medical grade masks that healthcare providers and people who are working in close proximity to COVID patients need every single day. we need to get to the point where we're not asking healthcare workers and frontline workers to keep reusing equipment past the point that it's no longer helpful to them. And I truly think if we can get everybody who watches this to participate in this fundraiser and to really spread the word, we can move the needle pretty far and get a lot closer to our goal of finding a solution to the PPE crisis.
I love breaking it down into that $1 increment or that $5 increment, because when we put something like that behind it, it makes it so much more achievable. Because if I know, hey, I'm not going anywhere, right? Like COVID has changed my life. I'm not spending as much as I did previously. And so I can take those extra dollars that might come up and say, hey, let me put it behind this cause, because contributions to Get Us PPE are tax deductible. And one of the things that I also wanted to highlight is that, a lot of companies, especially in tech, have corporate matching programs. So I know with one of my old jobs, if I donated $20 to Get Us PPE, my old job would donate $20 right back. And so I wanted to see, is Get Us PPE registered with those corporate giving platforms?
We are. So we have tried to make this as easy as humanly possible for anyone who wants to make a contribution. We are an official 501c3 charity registered with the IRS. So any donation of any amount that you make is tax deductible. And donations of PPE can also be tax deductible. So that's another avenue that people can use to help. But we're registered with any kind of giving platform that you can imagine. And if we're not registered yet, give us a call and we're happy to get on the list to make this easy for you. And Ashley, I love what you said about reorienting how we think about our budgets. I know that I'm not personally getting my fancy latte or whatever every day on my way to work anymore. And so that is a part of my budget that I've put aside to put towards efforts like these, so I can help to move that needle a little bit. And working at nonprofits, you do start to realize how much every dollar counts. And our goal is to keep our overhead as low as possible. And we want as many of the dollars that come into us to go towards our mission of getting PPE to where it's needed most. So we're here to be good stewards of the contributions that you make and the trust that you place in us. And I think through partnerships and relationships that we have with groups like yours, Ashley, it allows us to expand our reach and to make a bigger difference.
Awesome. Thank you so much for that recap. This has been a really great conversation. And I just kind of wanted to summarize what we talked about. So if people would like to help in supporting the mission to get PPE to those who need it most, they can donate to the fundraiser directly. They can donate supplies, which are also tax deductible. They can help volunteer if they have the time and the inclination to do so. They can share the message, right? And of course, most importantly, take those preventative measures now, because this is what is really going to drive that infection rate down and help us kind of get a handle on things, because we've seen it's really tough and we haven't had a handle on it. So taking those actions now. So there are a lot of ways that people can help. And just kind of to wrap things up, if someone wanted to share this on social media or anything like that, do you have hashtags that we should use or any kind of things to help increase that visibility?
Absolutely. So our social media team is fantastic and is always monitoring all of our channels. So we are at Get Us PPE across all social platforms. And the hashtag that we're using is also Get Us PPE. So definitely tag us, tell us what you're doing to make a difference. Our goal is always to amplify the work that everyday Americans are doing. I consider myself to be an everyday American, and I think you do too, Ashley. So I think what we want to do is show the power of everyday Americans coming together to find a common goal and to make progress on it.
Yes, we are stronger together. Dr. Gupta, thank you so much for your time. It was great chatting with you. I look forward to having more conversations, and we'll talk again soon.
Thank you so much, Ashley. It was a pleasure.